an eye to our health. So renal cell carcinoma is the most common type of kidney cancer in adults, but sadly, nearly a third of patients will not be diagnosed until the cancer is in advanced stages. Dr. Elizabeth Kessler from the University of Colorado Cancer Center and Brian Lewis of Kidney Can share how a new combination treatment is bringing hope. First off, Dr. Kessler, what is renal cell carcinoma and how common is it?
About 9 out of 10 cancers that start in kidneys will be renal cell carcinoma. And it is one of the top 10 cancers that affect men and women in the United States, primarily affecting men, as you already pointed out. And it's mainly diagnosed in adults. So adults that are in their mid-60s would be the most common age group that would be affected by this type of cancer.
Brian, what is the experience like for a newly diagnosed patient with advanced kidney cancer?
Yeah, thank you for the question. It's traumatic. Hits you like a ton of bricks when you first are told that you have cancer. And what I refer to the first couple of days, weeks are called the white noise period, where you don't really hear too much. You hear every third word, it seems like, because you're concentrating on your, what's next, what's going to happen to your family, what's going to happen to yourself. I think that's common amongst most patients. You'll hear variations on that story, but you start surviving, you start figuring out how to beat this disease.
Dr. Kessler, what is the new treatment and what is its potential impact?
Well, there is a newly FDA-approved combination treatment of 2 medications called Opdivo plus Cabometyx. And this is a treatment option for people who have kidney cancer that's been diagnosed as having spread to other areas of the body. Unfortunately, many people, when they are diagnosed, are already at this advanced stage, and this combination has been approved as a first-line therapy, so people who have never had any medications to treat this before. This approval was based off of a recent clinical research trial where I was an investigator for Bristol Myers Squibb, and in that trial, patients were treated with the combination of Opdivo plus Cabometyx and found to live twice as long without their tumors growing or spreading or worsening. So really improved that, what we call progression-free survival, or the stability of those tumors. We are really hopeful for this combination to continue to improve that overall stability and improve just the life that our patients with kidney cancer live.
Brian, what kinds of emotional and educational supports are available for patients and their families?
The American Cancer Society, our organization, kidneycan.org, has some patient resources that were supported through the efforts of Bristol Myers Squibb. There's a smartpatients.com community online of folks that are talking about their issues. So there's a lot of good resources out there for folks.
And for more information about the new treatment, go online to opdivo.com and learn about more supporting research and resources for kidney cancer patients. Actually, check out kidneycan.org. Joe?